Good morning, everybody. My name is Abdullah Sukari. We will talk today about very interesting topic, Guillain Barré syndrome. Our outlines divide into definition, overview, etiology, risk factors, pathophysiology, clinical manifestations, complications, diagnosis, medical management, nursing care plan, and finally, health education. Guillain Barré syndrome, GBS, is rare, acute, and rapidly progressive autoimmune disorders. That means the immune system attacks a part from the body. This part is a peripheral nerve that can affect the sensation and affect the mobility. This disorder in which the body's immune system mistakenly attack a peripheral nervous system, it's occur at all ages, but more commonly in adults. With varying degrees of weakness, it is characterized by symmetrical muscle weakness that usually begins in the lower limbs and ascending upwards, possibly leading to total paralysis. In severe cases, it may involve respiratory failure and autonomic dysfunction. The exact cause of GBS is unknown, but it is often preceded by an infection such as Guillain-Barré jejuni. This is most common bacteria, cytomegalovirus, Epstein parvovirus, influenza virus, COVID-19, this recent associate, Zika virus after vaccination, this rarely, and post-surgical or post-traumatic triggers. We said before the age is a risk factor, but it can happen for any age, but it's common in adults. Viral bacteria infections like especially Campylobacter, like we said before, surgeries, sugaries, or lymphoma AIDS, okay? Uh, mm. Pathophysiology, the immune system produces antibodies that mistakenly attack one of maligned sheath. If you like here, this picture is a very beautiful picture. We will take a pen. The part that will be attacked by immune system is maligned sheath. This part is like the wire or the very important part of neural cell. When this part attacked or destroyed or damaged, the signal of sensation will not reach to the part of the body. That make this part is blind for any signals or any messages, okay? So the immune system attacks this part and cuts the sensation and maybe destroy the sensation transmission, okay? So the immune system produces antibodies that mistakenly attack the myelin sheath or axons of peripheral nerves. This result is make a terminology called demyelination. That means destroy or remove the cover of the axons of the cell. Nerve conduction making a blockage and impaired signal transmission. According to this damage and variety of damage, we can classify the disease: acute inflammatory demyelinating polynephropathy. This is most common. Acute motor axonal neuropathy, acute motor sensory axonal neuropathy, Miller-Fisher syndrome, characterized by orthomalacia, ataxia, and areflexia. The clinical manifestation is divided by initial symptoms: tingling, numbness, muscle weakness in legs, loose reflex, progressive symptoms like symmetrical paralysis, facial muscle weakness, difficulty swallowing and speaking, respiratory muscle involvement, and autonomic dysfunction. Complications like respiratory failure require mechanical ventilator and deep vein thrombosis, pressure ulcer, infection, and cardiac arrhythmias. Diagnosis: At first clinical examinations, the doctor will look the various symptoms and signs in addition to choking or saliva or difficult speaking, chewing or swallowing. Lumbar puncture, elevated protein levels in cerebral fluids, CSF, without increasing white blood cell count. Nerve conduct studies, our nerve conduction studies showed conduction of pulsites, electromyography, MRI or CT to rule other cases, pulmonary puncture tests to monitor respiratory muscle involvement. In medical manifestations, first thing and high priority is hospitalization. That means using ICU at first, close monitoring, therapy is very, very important. Medication like IVIG, intravenous immunoglobulin, blocks the damaging antibodies. Plasma pheresis or plasma exchange removes the antibodies from the body. These two types of medication or therapy is very important for the patient. Supportive care like mechanical ventilator if respiratory muscles are compromised, pain management, neuropathic pain, DVT prophylaxis, example low molecular weight heparin. Nutrition support may be required, feeding tube, prevention of pressure ulcer and infection. There is no prevention or preventive measures that can be taken to prevent disease, as it is still unknown, like we said before. The first priority in our nursing care plan is nursing diagnosis, and this diagnose at first important, like ineffective breathing pattern related to respiratory muscle weakness. The priority level is high, life-threatening. The goal, maintain effective breathing and oxygenation, monitor respiratory rate, depths, and O2 state regularly, assess for signs respiratory fatigue or distress, prepare for mechanical ventilator if needed, provide oxygen therapy and suctioning as prescribed. Second high priority level is risk for aspiration related to impaired swallowing reflex. Oral prevent aspiration and promote safe swallowing. Elevate head or the bed during after feeding. Assess swallowing ability before oral intake. Provide fluids for feeding tube if needed. Collaborate with speech therapist. Impaired physical mobility related to muscle weakness. This is a moderate problem or moderate level. Maintain joint function and prevent complications. Perform room exercise daily. Repositioning every 2 hours, also to prevent bed sore. Encourage participation in physiotherapy. And using ability aids safely. Nursing diagnosis. This is part of moderate risk, like risk for impaired skin integrity related to immobility. Maintaining intact skin, we need to prevent bed sore from happening. We have 4 grades of bed sore: first grade, second grade, third, and fourth. We know the first grade is very, very harmful and very dangerous. So we need to make regular skin assessment, use pressure relieving devices like air mattresses, shoes, maintaining skin hygiene. We turn patients every 2 hours to prevent pressure on cells and prevent necrosis of the tissue. Okay. Impaired verbal communication related to facial muscle weakness, like we said before, that affects the facial muscle. Low to moderate. Enable alternative methods of communication, like provide communications tools like board, tablets, writing tools to help patient to write what he wants, and we can communicate easily. Be patient and attentive. We need to be patient and attentive to the patient and wait for understanding what he wants or what he needs. Collaborative with speech therapist to make a patient easy to communicate. An anxiety related to sudden paralysis and uncertain outcomes. It's very important to refine the patient's psychological state. Priority level is low because this will not affect the physical part of the patient. A goal reducing anxiety and promote emotional stability. Provide clear and honest explanations. We need to explain everything about the disease to the patient to avoid any anxiety happen. Involve family in care. Use calming techniques and therapeutic presence. Refer to counseling if needed. In health education, patient and family education, at first, disease information explains the nature of GBS and autoimmune, often self-limiting condition. Treatment plan like educate about IVIG or plasmapheresis, possible side effects, importance of psychology or physiotherapy, and rehabilitation. Signs of complications. Teach how to recognize respiratory distress, infections, or skin issues. That's very, very, very important because the patient, when discharged or go to home, maybe some complications happen. We need to learn the family to detect these complications before it's go further. Nutrition and hydration. Importance of adequate fluids and nutrition intake. Safe swallowing techniques if acceptable, because patient maybe go to in very dangerous complication like shocking or aspiration. Psychological support. Provide counseling if needing, support group and patient's network to refine the patient psychological support. Repetition. Encourage long-term physical and occupational therapy. Promote independence as recovery purpose. At last, follow-up care. Emphasize the importance of follow-up with neurology and repetition team to avoid any kind of complications and refine the patient recovery process. Discuss return to work school plans when appropriate. Thank you very much.